So what does this have to do with sleep? The consequences of obstructive sleep apnea cause changes in the heart that lead to these electrical problems. There is a direct and irrefutable link between obstructive sleep apnea and SVT, atrial fibrillation, as well as high blood pressure or hypertension. Let's talk a little bit about hypertension. Um, Hypertension, conceptually, we have blood pressure that's a measure of how hard blood pushes against the walls of arteries as it transits through the body. It's normal for blood pressure to go up and down throughout the day, but if it stays consistently elevated, this is what we define as high blood pressure or hypertension. There's a connection between obstructive sleep apnea and hypertension. Patients with sleep apnea have induction of changes or remodeling in their blood vessels. This can have a direct correlation or result in high blood pressure in and of itself. This high blood pressure can then subsequently lead to hardening of the arteries as well as development of heart failure. And if you think before about the heart as a pump, anytime it's got to have more work associated with that pumping, which is what the scenario of high blood pressure leads to, people can develop congestive heart failure. A little bit more about obstructive sleep apnea and hypertension. From the epidemiology, we know that about half of obstructive sleep apnea patients are hypertensive. And we also know that about a third of hypertension patients have obstructive sleep apnea. So you can see the bidirectional relationship there. And there's also an even more concerning subgroup of patients with hypertension that we describe as resistant. In other words, they have high blood pressure and that they're on more than 3 blood pressure medicines and still have high blood pressure. Of this group, 83% have moderate to severe obstructive sleep apnea that is untreated. What can we do about this? We know that treatment for moderate to severe obstructive sleep apnea includes CPAP, and the usage of CPAP can directly reduce high blood pressure. Effective therapy, i.e., using a CPAP machine at least 7 out of 10 nights for 4 hours a night, does reduce your blood pressure. There was one well conducted study that showed that after 1 month of using CPAP as prescribed, you can achieve a 10 millimeter of mercury reduction in your systolic blood pressure just by using the CPAP machine alone. And the other improvement is not only is their blood pressure improved, but also their correlated symptoms of sleepiness. Looking at the treatment of obstructive sleep apnea, there are essentially 4 interventions that we speak to in sleep medicine. The first is conservative measures, and this is code for weight loss or positional sleeping. There are also dental devices that we use. These are devices that are placed in the jaw that cause the lower jaw or the mandible to be pushed forward. This allows the back of the throat to be more open. There's also surgical interventions for obstructive sleep apnea, as well as CPAP, which is considered to be the most definitive intervention for patients with moderate to severe obstructive sleep apnea. And essentially, with CPAP, it's not oxygen. Most of my patients will ask, do I have to be hooked up to an oxygen machine? But it's not the case. This is just merely standard atmospheric air that is pumped through the nose that splints open the back of the throat. It's a pneumatic splint. The air itself is heated and humidified, making this rather comfortable. We've spoken before about other treatments. Sometimes in patients with mild obstructive sleep apnea, we do discuss conservative measures. Again, that's weight loss and positional sleeping. We know that patients clearly have marked vulnerability to problems with breathing and sleep when they sleep on their back or the supine sleeping position. This can be mitigated by getting off of their back and sleeping in non-supine sleeping positions, i.e., on your side or on your stomach. And speaking to weight loss, a 10% change in weight or a 10% reduction in your body mass index can directly lead to a 30% reduction in your burden of obstructive sleep apnea. So, in one sense, it's a 1 to 3 payback. Determining obstructive sleep apnea and other sleep related disorders, you do not need a referral to come talk to us here at Iowa Sleep, but I certainly recommend talking to your primary care physician about your concerns. We would welcome the chance to do a consult and to talk to you further about this issue. In the central Iowa area, you can call 1-800 226 6084. Again, no referral is needed. I thank you for your time and attention this afternoon.
Well, thank you, Dr. Grant, for that very informative presentation. At this time, we'd like to ask you a few questions about from some of the members of our audience. I have several here. We'll start with number one. Should I be concerned with my family history as it relates to sleep and heart disease?
That's a great question. Um, in medical school, I learned that sometimes we can turn into our parents, but we can certainly take steps to prevent identifiable disease. I would say that there's a strong genetic predisposition to obstructive sleep apnea that correlates to genetic predispositions for heart disease and obesity. I can certainly advise my patients to look to their parents to see what disease processes they have and try and modify any risk factors as they can at this stage in their life.
Great. Number two, are sleeping pills an effective way to treat OSA?
Sure, I would say emphatically no, but I think some people stumble upon sleeping pills innocently. Uh, People can describe difficulties with insomnia, and we describe insomnia in two different flavors, if you will. There are troubles with people falling asleep. We call that onset insomnia. And there are troubles with people staying asleep. We call that maintenance insomnia. And when I hear about maintenance insomnia, to me, that's strongly evocative of asking the question of whether somebody is waking themselves up because they're not breathing right. The brain is pretty smart and will always choose breathing over sleep. But the problem becomes if someone is taking a sleeping medicine, that that reflex to wake up can be blunted by the sleeping medicine. And so that can cause real problems for people when they need to wake up because they're not breathing right and they've got difficulty waking up because they're taking a sleeping medicine.
Okay. Number three, what lifestyle changes should I make to reduce my risk of OSA?
If I had one statement to make, I would clearly recommend taking a look at your body mass index. We know that obesity and weight gain is clearly related to sleep disordered breathing. And most patients, upon history, when you talk to them about when their difficulties with sleep became very real or identifiable for them, usually that correlates with changes in weight, specifically weight increase. I'd also state that avoiding alcohol is always a good idea. Alcohol can relax the muscles in the back of the throat. And if people have a subclinical threshold of obstructive sleep apnea and indulge alcoholic beverages in the evening and then fall asleep, that subclinical threshold can become clearly clinical and pathologic.
Okay. Is there a typical age when I should be concerned about this problem?
Um, it's my experience that in the fifth decade of life, which is your 40s, that's usually where I find some patients examine what's happening with their sleep or kind of say enough is enough and something needs to happen. Whether that's their bed partner strongly advocating that they talk to their doctor about their snoring or the fact that they feel tired. But again, I think it's always a good idea to any of my patients over 35 to have regular physical exams every year. Make talking about your sleep and your energy levels a priority with your primary care physician and act on this data as necessary.
Well, thank you, Dr. Grant. This concludes our presentation today. If you or someone you know is interested in learning more about this important topic, we encourage you to contact Iowa Sleep online at iowasleep.com or by calling 1-800-226-6084. You can also follow Iowa Sleep online at facebook.com/iowasleep and on Twitter at Iowa Sleep. Have a wonderful day and a restful evening. Thank you for joining us.